The response went very well. It was only 19 minutes from the time Derek landed until Derek was in the operating room, getting his subdural decompressed. And when he hit the operating room, his core temperature was the 32 degrees. So we did everything. Everything went perfectly, and we were hoping for a good outcome.
And then as soon as Dr. Burton and Dr. Kent were out of surgery, they did take us into a room to talk to us. At that point, they explained to us just a little bit about what they had done. Actually, Derek's condition, I just can remember thinking, here are these two total strangers, standing with us at probably the worst time of your life. And, they had just saved your child's life. And you had never met them before. They didn't know you. They didn't know him. And somehow they cared enough just to do that. The time, I'm probably not going to get any of it correct, but I think it was probably about 2 hours after the surgery is when we finally got to see him for the first time.
What was that like?
Overwhelming. I mean, it was, you walk into a room, like Jen said, he had a lot of wires connected to him, breathing machine, just everything, and it was very scary. It was something that, it's a vision you have in your mind, but, your life changes in a second. I mean, it just really, there was just a second there that, the injury took place, and, our life has changed forever.
It really is the toughest road there is. What they had to go through is about the toughest road that a parent ever has to go through. And from my perspective as a pediatrician, I kind of see all the happiness and a lot of the good things happen, and really good things have happened here. I'm not an expert in ICU care by any means, but I've got a fair amount of experience there, and I know my way around a little bit. And probably the hardest thing to do is just to be patient in these circumstances. The trauma team really does all the work, and they really have a hard job to be absolutely ready at the drop of a hat. They don't really get a second chance, and I'm deeply appreciative of all the work that they do. And I've had several patients there over the years, and their level of care from my perspective is over the top.
Initially, obviously, after the surgery, he was unresponsive, unconscious, and that's right away when they had started the cooling technique. And he remained cool for about probably, I think it was about 36 hours. And then slowly they started to rewarm his body temperature. At that point, he did respond a little bit after he started to warm up a little bit of eye opening, a little bit of hand movement.
Once the pressure monitors were removed, we took him to the MRI, and Dr. Kent and I were very interested to see what the structural damage was on the MRI. And we were very disheartened on the very first MRI that it looked like the radiologist said it basically looks like a lot of cell death all along that side, all the way back into the occiput on that occipital lobes, which worries of, is he going to be able to even see? Is he going to be blind? All of those issues. So we knew that he had survived more than would have been expected, but then we were sort of disheartened that we saw so much cell damage. 2 days later, after the second decompressive craniectomy and things were getting better, we just really couldn't believe that much cell damage was there from what we were seeing. We went down for a second MRI of the brain, and Dr. Kent and I were there, and we were both very surprised. I've never had it told to me before. The radiologist called back and said, is this the same patient? He said that all that tissue on that side that we thought looked dead on MRI now is sort of signaling just as being edematous. So we were elated. It's a small little thing, but I tell you, we were elated. We went out and we did tell the family, and Jen and Royce were very excited to see us be excited. But we knew that this has never happened before, and we were quite excited that we had been able to come up with some new treatment that was making some effect that we had never seen before.
It's amazing just these little baby steps, how excited you can get. And, if somebody says, oh, they just opened their eye or they just moved their pinky, that's a huge thing. It's a huge thing for somebody with a brain injury. And until you're really in that situation and until you wait for days, weeks for them to be able to do that, it's hard to even appreciate how excited that can make you feel. And then to finally see him be able to move his foot for the first time and to move his leg for the first time, it's just really rewarding.
We'll show your best side.
Yeah. Which side would that be, huh? My job is to keep him stretched out. So this is where we spend about 45 minutes every day stretching. No, he's just, I don't know as I've ever, and I coached for 30 years and been a therapist for 35 years. I don't know if I've ever seen an individual like him. The more you do, the more he wants to do, and he never complains. You think he'd have plenty to complain about, but he just never does.
What's it done for your guys' relationship, just to be every day working out here and everything and having this?
We bonded right there. We've gotten really close, but I don't know if this is the way we wanted to do it, is it? But it's been good. And like I said, he's bound and determined he wants to run proactive this spring, and he's going to get better and better yet. He's getting there. He just works unbelievably hard.
I've thought a lot about, what I guess you should say or what I would want to say to his caregivers. And, thank you, but that seems so kind of cliche. And it's so hard to even find the words. But it's just amazing to me, and I think I said it before, that people that you have never met before can come together at the worst time of your life and treat you like family. And I think, and I remember right before Derek's second surgery, just saying to Dr. Burton right before he took him up, I said, just treat him like he's your own. And he said, I always do. And I think that says it all about all of the caregivers there. They treat everyone like it was their own son, mother, child. So it's amazing.